Okay, okay. So, Assalamu alaikum, and I'm Beena Raza. I'm an educator and trustee with Sanjan Nagar Public Education Trust. So, I would like to welcome everyone today who will be listening to the conversation and joining us to for this evening's celebration of International Women's Day. So, we have some eminent panelists today who would be joining in and sharing their perspectives. And I'm truly honored that I was able to get hold of them because they're extremely busy professionals. So we could perhaps start with the introductions, a round of introductions. And I could do that, but I think it would be wonderful if we could start with perhaps Dr. Neela. We could start with you, and then Dr. Nawal and Dr. Zara. Is that okay? Or um, I think that would be a good idea that you guys can talk about your journeys yourself, and then we can take it from there.
Okay, so Assalamu alaikum, Beena, and thank you very much for inviting me for this International Women's Day. I am Dr. Neela Darbar, and I am a neurosurgeon by profession. Besides doing neurosurgery, I also have a management role, and I've recently taken up a position as a medical director of a very newly built hospital in Multan, which is called as Mukhtar-e-Sheikh, or we call it MASH. I still carry my passion, which is neurosurgery, and I work at Aga Khan University as well as in MASH in Multan.
Wonderful, Anila, and I think many of us are aware of your accomplishments, and but I'm glad that through this platform a wider audience of people and young people aspiring to maybe neurosurgeons, especially women, young women, would be delighted to hear you talk today. So, can we move on to Dr. Nawal? Would you like to also share your professional profile and your journey?
Well, okay, so my name is Nawal Salahuddin, and I'd like to thank you, Beena, for setting this up. And I hope this forum is the beginning of many other forum where other young women, young men can interact and learn the value of what we're talking about. So I'm an educator, I'm a clinician. My interest is critical care medicine, though I trained in both pulmonary and critical care medicine. My current passion is to develop critical care service and research within Pakistan. And so right now, I'm working at a government hospital in Karachi, where I've set up critical care training programs. I've developed a tele ICU critical care outreach program for hospitals in the interior of Sindh. And especially during the COVID outbreak, we had the opportunity to interact with physicians in Sakkar and Tanda Muhammad Khan and Ghambat and help in the management of critically ill patients. These are some of the things I do. On top of that, I do have an interest in bedside clinical research, and I've had the privilege of interacting with Dr. Zara, who's our third panelist, in some projects. And I'm just going to hand it over to Zara now and let her introduce herself.
Thank you. Thank you for doing that. Yes, Zara, we look forward to hearing from you.
Assalamu alaikum. Thank you for the invitation. It's a pleasure to be part of this panel. I'm Zara Hassan. I'm professor at the Department of Pathology and Laboratory Medicine at the Aga Khan University. So I trained as a scientist focusing on infectious diseases. So, and my research has been in trying to understand how both immunity works, meaning how defense mechanisms work in disease and how one can test bacteria and viruses. And my role, in addition to research, is in the molecular diagnostics laboratory at the AKU. So that's a service laboratory. And one of the things we do is rapid diagnostics for things like viruses and oncology and various tests that require genetic or genomics tests. So with regard to COVID-19, when we heard that the virus had, been identified in Wuhan, the first thing we were asked to do, it was take the initiative to try and develop a test. So as early as January, then we went about trying to get the reagents, the supplies to set up a diagnostic, which we did. We've done in the past, every time there's been a threat of an epidemic like the MERS or the Ebola epidemic, which was in 2014, 2015. So we started off thinking it would be something like that. But of course, it was nothing like that. But so that has been essentially been one of my roles, setting up diagnostics, which have in this pandemic played a greater role than ever before. And I've worked with scaling that up at AKU, and also we worked very closely with the provincial government and also the NIH in Islamabad in expanding diagnostics and rolling them out. Thank you.
Thank you. Thank you, Zara. That's very interesting because it's a very interesting panel with diverse experiences and backgrounds, though all coming from the medical sector, but playing very different roles and very, very relevant to the pandemic. So, just briefly before we start with the conversation, just to let you know that speaking from the platform of the Sanjay Nagar Public Education Trust, it's an entity that is firmly committed to quality and to gender equity and enabling our females with a mindset and a certain skill set, which really triggers a journey of excellence, and then not only in their personal lives but professional lives, and also it kind of reaches out to a larger community of women who share and who can inspire while nurturing their own skills and their own thought process. So just to also let you into my little world, which again it's a wonderful way to reach out to a larger, wider segment of younger women. So I'm hoping that they would be also benefiting from this conversation. So coming back to celebrating this day today, and as you know, 8th March is an annual International Women's Day, and where it's a global day where you're looking at celebrating socially, economically, and culturally and politically successful women. But somehow I've always had this feeling that in Pakistan, there's not a whole lot of emphasis and focus on. I don't know if I want to use the word successful, but women who've made an impact in their fields and are leaders and who've done exceptionally high caliber work in medicine. And coming from Lahore, I have experienced the health scene in Karachi, and I think especially in Lahore and Punjab, there's less of that. So, looking at powerful local women leaders who come from the health sector, and to discuss this year's theme of what the hashtag says, choose to challenges. But what we thought was more beneficial in the context of the COVID-19 pandemic was that the fact that it's made a mark on the entire globe, 2020, and with this backdrop, especially women and girls um, in all their diversity have been impacted in multiple ways. And in the health sector, especially, they're particularly affected by the heightened pressure on health systems and have been subjected to acute stress and high risk working conditions, which further increase the risk for infections and vulnerability to many other factors such as mental health and physical health. So, among a majority of female working force that are out there in the medical sector. So, supporting women's central essential roles in responding to the pandemic with the health sector is therefore critical. So, keeping that in mind, I think it would be beneficial to all of us if we could start with perhaps Dr. Anila, who could talk about it from her perspective. And we could start with Dr. Neela's perspective on her role, and again, coming from a leadership role, and recently set up Dr. The hospital that's been set up in Multan. So I think that would be very interesting. Dr. Neela, if we can hear something from you on this whole pandemic, and how you have been, you know, how have you managed the crisis?
So, Beena, when I had joined this hospital in Multan, I mean, this is a absolutely brand new private hospital, and it had just started when I had joined in early January. And as you know, by March, COVID-19 had hit, right? So, I mean, we were just in the beginning phase of developing this hospital, and what we had to do is keep all the other ideas by the side and make the hospital sort of ensure our employee safety against COVID. Now, we were one of the hospitals, since we were a private sector hospital, we were not taking many COVID patients because most of the patients were actually going to Nishtar Hospital, which is in Multan. But what we had to do is have to start developing COVID policies and SOPs as early as mid March. In fact, I would say early March, when the numbers were rising and the lockdown had not had happened at that time. Um, and it was a very challenging task for me. Nobody knew, what kind of SOPs are going to be required in early March. And these SOPs just kept on changing as the months changed. And in the beginning phase, first we just shut down the hospital for a little while, which I think every hospital did, that they absolutely reduced the numbers to only up to the skeleton crew in the hospital. And at that time, we had the chance in my hospital to start developing the teleconsultation services for sick patients, although the emergency room remained open. But we, of course, had all the SOPs that later on everybody followed, which is, wearing masks and face shields and gloves and having an isolated negative room if some patient with respiratory symptoms are coming through. And teleconsultation was the first thing that I had developed at MASH in Multan, which was as early as in early April. And then we also developed telepharmacy so that a patient can just call in, and we were actually sending them the drugs through our bike riders, especially people who have chronic illnesses and diseases. And we also have a psychiatric hospital, and they also require medications that have to continuously given to them. Beside that, we also wanted to ensure our COVID policies for our employees. So initially, some of the employees were, of course, sent home. But as you know, as the May trickled down and June trickled down, some of the employees were called back. And they were, because in Multan, a lot of the Multan division is quite vast. So people were coming from a lot of different divisions, and we need to ensure that none of them have symptoms, and if they have symptoms, they report. And we had an online form policy in which everybody who goes to Multan needs to fill up a form, which is a sort of a health check form. That they need to fill up, and dedicated to make sure that if somebody has symptoms, they are isolated or their tests are done. And the hospital was providing all the facilities regarding that. Now, in spite we were not taking COVID patients, in the emergency room, many a times a COVID patient would show up. Many a times patient would arrive dead in the emergency room. People with severe symptoms would arrive in the emergency room. And of course, when the life-threatening situations are there, you have to take care of them in the emergency room. Good thing was that our emergency room is set up with a lot of negative isolation rooms, so we have created them. Patients were usually taken up there. And then depending, how the symptoms are, we would actually, if we think that they were COVID negative, we would keep them in the hospital. Otherwise, we would actually shift them to Nishtar Hospital. And as the months grew, from July to August to September, we had a first wave. We went down, and then in Multan, even I would say that even in the month of April and March, when the COVID was on the peak, if you would have gone to a Multan market, it didn't even seem that there's any COVID around here. And people were without the masks. And I mean, in bigger cities, people would have followed the SOPs, but here in this smaller town, I never saw people following any SOPs like judiciously. And the second wave came, and again, the whole challenge was to keep on changing your COVID policies, and sometimes we had situations in which political members of the family in Multan would force us to take COVID patients, and we had to take care of them, and we have to get all the setup, because we were not a big hospital. We didn't had a very good setup for critical care or ICU. But this COVID taught us that when emergency comes, you just have to figure out and work together as a teamwork and bring the right people in, whether it's through teleconsultation or getting some critical care person from somewhere else, and then you just bring them, and then you have to just run the hospital. So this was sort of my journey during the COVID times, and I hope the third wave doesn't come back, because we are sort of becoming a little lenient on our COVID policies now. Although in theaters, we still check patients' COVID PCR before we let them operate, because there's a huge big data out there in that the surgeries are performed with a PCR which is positive, then patients usually have a bad outcome. So we have been very cautious about that. But as the time is passing by, the COVID policies are sort of, people are becoming lenient about it. And as Nawal was saying, that I hope the third one doesn't come, because probably everybody is on their limits. So that was sort of
Yes.
my journeys and challenges, in managing a private hospital during the COVID times.
No, that's a pretty huge challenge, Anila. And before I move on to the next panelist, just a quick question. So, what would be the percentage or the ratio of women who were firefighting at that point in time? Were you the only one in the hospital, or you had a large team of female? Because unfortunately, I have to put my gender filters on. So,
Acha, so Beena, we have a lot of, the good thing is that in this hospital, we have a lot of females in leadership roles. So I am the medical director, but we also have our head of pathology department, who's a female, our head of family medicine, our head of pathology, our head of radiology. We are all female, and they were all part of our COVID committees. And so I would say at least 50% of the women were in the front in this hospital. And I think in this hospital, there is quite a balanced, and there is a gender equity in this hospital. That's what I would say.
that's wonderful to know. So that's a very positive message that you're sending out. That where there's a definitely a gender balance, and that made probably would be a significantly contributing factor towards. Of course, the crisis was there, but by the time you were able to navigate the terrain, we all went through that crisis. But as medical health workers, I'm sure it's not been easy for you people. But I'm glad things are more settled now. So now, as I move on to our next panelist, Dr. Nawal. So being a frontliner yourself, and now Anila has set the tone for the whole COVID challenge when it began, the crisis management. Regarding the need of ICU setting and the volume of COVID patients, how did you rise up to that challenge with your background? And you're a pulmonologist, and so how was that experience? Again, wearing the gender hat as well.
So first things first, really quickly. When COVID happened, I work in a government hospital we had no choice. We were not a COVID hospital, but the patients come, like Anila said.
Yeah.
And we decided that we would actually step up and plan for it and do it right. So we had the advantage of leadership that understood this, and we had the advantage of being able to plan before we were inundated, before the tsunami came. And so we set up a COVID unit. We took care of people. We've had, alhamdulillah, we've been very lucky. We've only had 22% mortality. And for those people who understand this, that's pretty good. That's comparable with what I would say North America has been really bad this time around. So I think this is good numbers. Anyway, but what I want to talk about, Beena, in the context of where we are right now and what we're talking about. So the government hospital that I work in is a major cardiovascular unit. It reaches out to not only Sindh, but also KPK, Punjab, Balochistan. So we have patients coming from everywhere. It's primarily a cardiovascular facility, so it has cardiovascular trainees. Now, when you spoke to me about this, I went back and I looked at what kind of numbers we have. About half of our trainees are women. Mm-hmm. If you look at senior leadership, then no, there is no woman in senior leadership. All right. There are about 25 professors, of which there are 3 that are women. Myself not included. I'm the 4th. I forgot to count myself in that. Anyway, however, in my department that we set up, the Department of Critical Care Medicine, I am the associate director, clearly a woman, full professor. I have 9 fellows, of which 60% are women. I'm very selective about taking people who look like they're committed, who've done their homework, but I would do like to take women because I feel that we need to give our sisters a helping hand. So in our program, which is a very rigorous program, we're flexible. We have women who have children. This is very difficult. It's almost unheard of to have trainees in critical care that have families. But I wanted to make sure that if you've done the work, if you're willing to step up, then we should be able to make that happen. And so 3 of our trainees have children that are under the age of 10. And if they come to work, they do 1 in 4 call. They do their training. And I would say these are the best trainees I've had. And I've worked in North America. I've worked in Saudi Arabia. I've worked at the Ardern. These are the very committed, hardworking people who will change critical care in Pakistan. So we've had women at the front line. These women and my 3 men trainees were part of the COVID frontline. We set up the COVID unit. They were there with PPE on every single day for the past year. They are the ones who did the work. That is why our mortality is so good. They were the first people at the vaccination center. So they led from the front to show that this could be done. There was a lot of reluctance, there still is, to get vaccinated. And I think Zara will chime in on that as well. But these women and my 3 men, of course, are showing other people within our institution that getting vaccinated is as important as showing up and working at the bedside. So in our institution, our senior leadership has empowered me and my fellow infectious disease consultant, who also happens to be a woman, is also a full professor, to allow this kind of environment where women are nurtured and allowed to grow. 2 of my fellows have graduated. They've been hired back on as assistant professors. So in a government institution, we are seeing inclusivity. We are seeing no distinction because of gender, but actually value given to your worth and what you bring to the table. And this is happening in a place that you would say, maybe not, but this can happen in Pakistan. And so I wanted to illustrate that.
Yeah. So that's interesting. You tell me that at the leadership level, there were very few females, right? And you said more than 50% were, it was a male-led, uh, initiative in the ICU. Do you think that if it was the other way around, or even if it was at parity, do you think that would have changed things? The crisis management, decision making would have affected that? I mean, I do get a good message from you that you had a very supportive um, leadership. But uh, can you hear me?
Sorry. You mean, no, I can hear you. I'm just trying to think what exactly is your
So I'm
question?
just saying
Are
that
you up?
had you had more women in the leadership, would have impacted in a positive way. I mean, you managed it, but would have been
We did
smoother.
actually have, we had mostly women in the leadership that set up the COVID unit and managed the COVID unit. My fellow director is a woman.
Oh, okay,
And I think that is because we work so well with
okay,
each other.
okay,
Would we
okay,
have as much if this was if a man had led it? I don't know. I mean, of
okay.
course, we're not
I
here
got the feeling
bashing
that
men.
there were less women at the leadership position and more.
There were. There absolutely were. But what's happened is with COVID, people came up, people took charge, and they've shown that they've done a great job, and now they're valued. So COVID it was a horrible year, but it provided an opportunity for a lot of women to come forward and be recognized for the value they bring to the table.
Yeah. Thank you. And no, that's very helpful. But and for Zara, who seems to be in a very different, diverse kind of, who's in research. So Zara, I mean, so you were in the, I suppose, in the laboratory and looking at the viruses and so what kind of studies were you involved in towards understanding this virus and the disease it causes? I mean, what was happening in your sphere at that point in time?
So I'll talk about the research that we're doing a bit later, but just following on from the hospital conversation, I want to talk about our hospital service. And so the Khan University Hospital is very gender balanced. Our CEO at the time was also a woman and incredibly supportive. We have many professors across the university who are female, and particularly our department of pathology has had female leadership. So in my laboratory, there were about 40 people, out of which 80% are female. And it is these staff that actually had to put up with the load of COVID testing. And I mentioned before, the diagnostics has never had such a big role, but because we worked as the support for not just Karachi, but Sindh, we had a whole cohort of people, young people, who had not been trained to work safely with viruses. So a big challenge was actually safety of our technologists, our very young teams, who not only had to work in, with the masks and the PPE and work with the samples that were positive, but also they had to work through the night, which was again something that becomes difficult because we had a predominantly female team, and we not only had to run the day and evening shifts, but we had to move to night shifts as well. And so that becomes challenging. And, it was only possible because the hospital then, the laboratory had to set up a system of supporting transportation for them. And I want to say one thing that, we've realized that the pandemic has had an impact on women, but it just to say that how difficult it was for the young people working with us when the daycare facilities shut down. So there was no option for us to work from home. It was all hands on deck. Everybody had to be there physically. And when schools shut down and the daycare, because AKU has daycare, so a lot of our female staff actually has small children that are taken care of, 8:30 to 5:30 by the daycare facilities. So that became very hard. So how effectively they were able to function, often dependent on the kind of support structure they had at home. So that is a recurrent theme across the board in the past year. But coming back to our staff, they have been incredible. Young girls who, with very little exposure, more and more of them were recruited to our teams because we repurposed the people working in other services, because things slowed down for a long time. The hospital slowed down, so COVID became key. So, we were primarily running those services. And so it's been a very, very interesting experience, and our teams have been very cooperative and very well supported by our deans and our management. With regard to research, we are studying both the virus and what happens to people with COVID. So we're one of the few laboratories in Pakistan who have studied the variation in the viruses. Maybe you've heard of mutations, which is how the virus changes. And initially, when SARS-CoV was identified, it was thought, oh, it doesn't change so much, and the diagnostics will be robust, and it'll always be that once you get over your infection, that'll be it. You'll have immunity. But now we've learned so many things. You can have reinfections. The virus can change. New variants can be more difficult to recover from. So those are the kind of things we're looking at. And we're using a genetics approach to do that. And we've done that through collaborations with with a number of international partners. So it's been a big challenge working in the environment, but it's also been very exciting because people have been very open, very collaborative, and COVID science has been so global that there's been a lot of information available that wasn't there before. So in that sense, it's opened
And
up
I'm
new
sure
opportunities.
this must have attracted a lot more women in the field of research and genetics. I'm sure because of COVID, because this, I mean, even as lay people, we had to, we became our sort of, as lay people, we wanted to know what the hell was happening. Where are these the second wave and the third wave? But so I'm sure that must have generated a huge amount of interest in medical students or researchers who are pursuing biological sciences or biochemistry. So that must have impacted. I don't know if you've had young women coming to you
So,
and saying that.
so, so 90% of biological science students are female
Wow.
in the
Okay.
universities. In any
That's a very
case,
interesting stat.
mostly women going into biological sciences.
This is about
In any
Pakistan.
case,
In
I'm
Pakistan.
talking about. I know about Karachi, so for Karachi for sure.
Yeah, yeah, okay, that's interesting. Well, I'm
And
I'm hoping
so,
that you guys can come up with something. I know it doesn't lie in your domain, but the whole policy of vaccination rollout is a bit messy for us when we try and see India's getting a vaccine at 250 per two shots by the private sector. So again, that's a bit of a political slash policy issue. So I don't know. So that's an area of concern for us. But again, it's just a comment, really. But I think yes, it's for you, somebody like you who's in research and laboratory research, must have been a very exciting
well,
time.
Well, with regard to vaccines, I'll just say that, it has really highlighted the importance of science driving policy, because so many things were new. They
Right.
were, sort of new SOPs that were mentioned that, as Anila said, the SOPs were new. The way treatments, I'm sure that new treatments, new therapies that were used in the hospitals, those were new, but they were all based on new scientific information. So I think the importance of science has really come up as something
Yeah.
that should be a strength. And we need to have more science and research at institutions to be able to make informed decisions as we need.
Right, right. So, as a wrap up, from each one of you, what are those um, you know points of reflection which could be a good message for younger women out there who would be aspiring to um, enter the medical sector, the health profession, whether it's health sciences, research, medical practitioners, neurosurgeons. um, what would be the takeaway from this crisis, and what could be better, what how the system can be more conducive for a better training environment, learning environment, and what can the media and civil society do to support that? Anila, would you like to say something on that?
Sure. So, Beena, as you know that, and Zara also pointed out that, a lot of women go into biological sciences, and even in medical school, 50% of the medical school class, even in Aga Khan, is 50%, but in other medical school is almost like 60-70% of the class are females. So, we do produce a lot of female doctors, and but unfortunately, what I feel is that some of them don't practice medicine later on, so they are. What the message I want to give to females over here is that the COVID crisis sort of, I feel, has highlighted that at these three hospitals that we are talking about, females have come together as a teamwork and have really proved that in crisis they can actually lead. And it's just not these three hospitals. If you look world over, in Germany, in New Zealand, women have really taken charge. The Prime Minister and Angela Merkel, and they have taken charge and have really showed the world that when the women are at the helm of a leadership position, things can go in the right direction, because women usually are less egotistical, and they do work in a team wise approach. So for the females who go into biological sciences, the younger females, I want to give them the message that please don't waste your education. And if you are a medical doctor, there is always a crisis of home versus professional life. And you don't have to choose one versus another. You can choose both of them at different points in time. When if you are raising a family, initially you can take few years off, but always come back to your profession. And they are now, since the COVID has shown us that you can work from home, and teleconsultation for doctors have become such a big deal now. These women who have families and who choose to take care of the children at home can use these kind of teleconsultation services to be productive part of the society.
Thank you, Neela. That's a very interesting perspective, and I'm sure that's a very important message that should be out there for our audience. Dr. Nawal, as a leader in the field, to what extent do you think women in Pakistan contributed to the control efforts both in health and in the health sector, especially being coming from the ICU perspective? Uh, I mean, again, you've already mentioned that it was a very supportive environment and women were really at the forefront. But what's the future like?
So, Beena, thank you. I think it's important to remember that critical care is an extremely labor and time intensive specialty. It's a subspecialty. And people tend to be scared of it because it consumes you. As you can see, I'm in scrubs because I just got back from the hospital. But the thing that I want to say, if this is a platform that young women are going to be listening to, what I would like to say is you can still do it. You can do anything you want to. What Anila was talking about, you educate, you work hard, you get good grades, and then you sit at home because you feel like you won't be able to give your family or your children the time that somebody else thinks they deserve. I have 3 children that are now grown up. I have a family. So it's not like I'm just saying something that I haven't done myself. I would like women to remember that if you've been smart enough, and if you've worked hard enough and you've been strong enough to get to the top or get close to the top, keep doing it.
Yeah.
There are always ways to continue. You don't have to make a professional sacrifice
Right.
because you think it's not going to happen. In COVID, I saw women set their children up in front of their laptops so they can do their online school and come to work and put on PPE and then go back to work and cook and do the things that they had to do. They've had to compromise a lot more than men have, because I doubt that any man went home and cooked a meal after working for 16 hours straight in PPE. Women in academics have compromised. They haven't published as much. They haven't been able to do research as much because there's been so much else. And I think women, it's true, they are team workers, they are empathetic, they are compassionate. There's been an emotional toll that's come with COVID um, that does affect you. It does affect your academic input, and it does affect your professional growth. So I would remind young women looking at it that we're all on the same team, we all have the same struggles, and that they should keep at it and not let themselves undermine themselves. The world is ready to do that anyway.
Yes. No, thank you very much. And in fact, I think you're probably the senior most person I've ever met in the ICU field, female.
Oh.
So for me also, it's just something quite a point to think about, because I normally we imagine men to be in the ICU, and that's how it is. But you do see the senior most nurses, the most well-trained nurses for the ICU, and the surgical nurses. But interestingly, yeah, I have seen, at least in Lahore, very few female doctors in the ICU. So that's again a Lahore, Karachi, or a Punjab, Sindh perspective. So those demographics also contribute. So, Dr. Zara, I was wondering that what societal for, I mean, as a wrap up with you, and then just a few comments, I mean, just a wrap up comment from my end, I suppose. So, what societal factors, need to be addressed for further enhancement of women working in scientific research based on this COVID experience? I mean, what would you say to
So,
that?
so I think Dr. Anila and Dr. Nawal have added very valuable points. There are no shortcuts. And in the medical profession, by the time you finish medical school, you have, if you persevere, you have a relatively straightforward path. You're a physician, you can see patients. It's much harder in a sense in the biological sciences because there's a lot of unknown. And that's why at the junior level, there will be many women
Yeah.
who work in, as junior technical positions, but fewer women who are senior academics because it is that hard. And the message really is to be brave, because women tend to think of others more and be less critical, often um, not be as vocal. And I think that is something that needs to be overcome, that women perhaps, at least, when it comes to science and research, second guess themselves more than men. And I
Yeah.
think that the only way to move forward is to just, give it a shot. And you never know if you have a hypothesis whether it'll work or not, if something is worth doing. There's so many unknowns. And we've seen that in the past year, that everyone was sort of muddling along, winging it. And it's those who just went along and did the work actually got it done. So I would just say carry on. If you believe in it, it'll work out.
Yeah. Yeah. Though I must say that, I mean, it's brilliant to talk to you and to look at your profiles, but I was just wondering that there are lots of female talent out there currently studying in medical colleges may not get the opportunity to go abroad and specialize in their areas of interest, whether it's research, whether it's neurosurgery, and we have very few neurosurgeons. I mean, Dr. Neela is one of the leading ones. Dr. Nawal, you're there. Dr. Zara. So you are the leading. You are the really the leaders in your field. But I was wondering that what about those majority of girls and young female aspiring researchers, practitioners, surgeons who don't get that opportunity to have a wider exposure, whether it's international through conferences. So I suppose that's something to think about. If there is a body like that which enables or is building that environment where people who have the talent and get the opportunity to maybe a mentorship model or something like that. So that was just that's something that came to me spontaneously as an educator. That I hope that
Can I just make a comment?
yes,
You
yes,
see, I mean, specific things like programs will continue, but I think that we all know that the hybrid learning and the online learning won't go away.
yes,
So the opportunities for learning from international, conferences or organizations has got to, come in the mainstream now. So I think in the long term, it'll make it much easier for people who couldn't have traveled and had those experiences to actually have them remotely. So that I think
yeah,
moving
that's a
forward will
very
be
good
helpful.
point. So technology is an enabler and an equalizer also in some respects, and I think that's one thing that COVID has taught the entire world, that how we use technology to our advantage. And yeah, so out of adversity, as they say, comes opportunity. So you're absolutely right, and I think that's a very good point. But it's interesting to see that UNESCO's, I don't know if the report is right, but I was looking at the data, which is 2019 or 2020, that women still account for less than 30% of the world's scientists and researchers. So I don't know. I mean, that challenge is still out there in terms of gender parity and medicine, science, research being an equalizer. That's still a challenge, and I suppose with people like you and then with your vision, we hope at least in Pakistan we can be, with collectively also address that and have more women uh, be taking part in research, in science, in medicine, health workers. I think about those fantastic nurses who've been out there at in frontline workers, played a major role. So absolutely. So thank you so much. I mean, it was short, but a lot of food for thought, and I hope we can continue with these conversations. This is first of the many. And again, thank you so much for your time. And inshallah, we should stay in touch. Thank you.
Thank you,
Thank
Thank you
you,
Beena.
very
Dr. Neela.
much.
Thank
Thank
you,
you very
Dr.
much.
Nawal. Thank you, Dr. Zara, for your time. And I should be putting this up soon on different platforms. Okay, thank you.
Thank
All
you.
right.
Great.
Good
Thank you for
night. Good night.
inviting us. Thank you. Good night. Bye-bye.
Pleasure to have
Nice to see you, girl.
Good to see you.
All
Bye,
right.
Zara. Bye, Nawal.
Bye, Anila.
Bye,
Bye,
Anila.
Bye,
Beena.
Nawal.
Anila, you
Bye.
look